Yeah, good morning everyone. I am Rahul Anuhad, COO at Cureka.com. Today we welcome you all to our live session with well-known cosmetic dermatologist Dr. Hema Sathish. We are going to talk upon the topic of hair care and scalp health. A lot of people have a lot of questions about scalp health. We have, about acne in hair, about dryness in hair, having multiple problems, whether you are any gender, any age group, any ethnicity, everyone suffers from some or the other issue around hair. Last week, we touched upon the topic of vaccination. I'm sure you loved the video. Today, we're going to talk about hair care. So here we are with our guest, Dr. Hema Sathish. Good morning, Dr. Hema.
Good morning, everybody. Nice to be here today again.
Yeah, so before we get started, let me introduce you to what is Cureka. Cureka is your online healthcare platform which will help you to lead a good healthy life. It has got products which are curated by doctors, and these products has been hand-picked and proven to be effective against any treatment concerned or any general healthy living. Cureka's products have been tested and used by millions of Indians, and they come under hair care, skin care, elderly care, pain management, skin care and maternity care categories. So now we're going to start our session, and if you have got any questions around hair care, you can drop in your comments and we'll be able to answer them within this session. Thank you. Dr. Hema. So we've got some questions coming in from our guests, and the first question that our guests have informed to us is, what is the importance of staying hydrated for scalp health?
Well, usually hydration means drinking a lot of water, but when it comes to scalp health and hydration, scalp health is very important for having good hair. Hair growth, to improve the loss of hair and everything. And hydration of the scalp is very, very mandatory, because there are many scalp problems which people come up with, like irritation on the scalp, seborrheic dermatitis, atopic dermatitis of the scalp, psoriasis of the scalp, and the list can go on and on and on. In these cases, the best thing to do is hydrate the scalp really well. So now first to come about is how to hydrate the scalp. First thing is, a very basic Indian way of hydrating the scalp is using oil. And the best oil to use is coconut oil. And there are researches which have shown that the lauric acid in the coconut oil helps bring down the irritation and help the microbiome on the scalp. So what happens is, we need some good bacteria, we need some good fungus on every part of our body, like especially the skin has got some bacteria, some fungus. Even on the scalp we have that, and that natural biome has to be maintained, and coconut oil helps a lot in that. Of course, there are many other things you can use, like there are scalp conditioners, then you have scalp packs. So many other things are already there in the market. Anything which helps you can be used, but scalp needs to stay hydrated for a healthy scalp.
Right.
And for healthy hair growth.
So there are a lot of myths, guys, that all bacteria and all fungus are unhealthy. So Dr. Hema has informed us that some form of bacteria and fungus is actually good for your hair. So the ecosystem of this, or the biome which Dr. Hema told about, for this bacteria and fungus need to be in a healthy state. For that, use some oil, hydrate yourself. Moving on, we've got another question, which is, what are the different hair care regimens which can be used for dry scalp?
Well, first is hydration, then using a very mild shampoo. Usually shampoos which are alkaline or acidic won't help. But nowadays there are very good pH balanced shampoos and very mild gentle cleansers which you can use. And according to, if you have a problem on your scalp, then avoid some chemicals like SLS. Sometimes what happens is SLS per se increases the irritation on the scalp, so that can also be avoided. If that is avoided, then the irritation comes down per se. And many a times you might have some mild fungus that's called Melassesia furfur, which is commonly causes dandruff in your scalp. If you have that, then using ketoconazole in your shampoo, or there are many other antifungal agents which can be used, like oxyconazole also has got shampoos with them. So you can use those shampoos containing these ingredients to help your scalp clear off this fungus. And there is something which you must have heard generally, ZPTO. So that component also, if it is there and it is used for quite some time, it decreases the irritation on the scalp. And these are all proven by research papers also.
So guys, when you are going to the next supermarket visit next time, you know which ingredients to look out in your next shampoo, conditioner and hair care product. Now, still, if you've got any question about which hair product is best suited for you, go visit a dermatologist, because they are the best guys who can guide you. Right, Dr. Hema?
Yeah. And if your scalp is very dry, as I said, you can use the mild, gentle scalp scrubs, you can use scalp packs, you can use conditioners, anything but to decrease the irritation on the scalp. Sometimes we use light therapy also. If you go to a dermatologist, they would ask you to do light therapy also. And there are some low light lasers which are handheld, and they can also be used on a regular basis if you have a scalp irritation which is not related to some problem as such. Like if you're having psoriasis or some other condition, then you will need to treat it differently. Otherwise, yes, you can use low light lasers also to improvise the irritation of the scalp.
That must be very insightful and useful for a lot of our guests. Guys, if you have got any questions around your health condition, about your hair, please drop in the comments below. We will take them up during this session. Also, if you've got questions around any other healthcare treatment, or maybe skin care, hair care, baby care, we've got a free WhatsApp platform on Cureka.com. Dropping your questions, our healthcare experts will get back to you within 24 hours. So moving on, we have got the next question with us, which says that, what is the link between stress and scalp dryness?
Stress is a very, very important factor, and it's there in everybody's life, so you're not an exception to the rule. So what happens is when you get stressed, you're secreting a lot of acid in your system, you're not taking care of yourself, everything, your wear and tear inside your body, every cell wear and tear is increased. That's why they say keep stress under control. But yes, it's very difficult to do that, I do agree. But yes, you should try to find ways and means to keep your stress under control. So when this happens, yes, it has been proven that the scalp can get extremely dry, or you can have irritability. Because many times what happens is when you have stress, you have some weird conditions which patients present with. Like they might say that the scalp is very itchy, or they try to keep your hand on the scalp because that relaxes them kind of. So some form of relaxation comes in when they do such things. So people do present with very weird conditions, and gastritis is one of the main thing which stress triggers, and that in turn leads to bad absorption of your food, and then you have so many other things which keeps cascading, and in the end result will be hair loss. So stress per se doesn't directly cause the hair loss, but then stress causes so many other cascading effects in your system that it leads to a lot of scalp irritation, or it can lead to finally hair loss.
So a chain reaction forms as soon as you have stress, which leads to eventually scalp dryness. That's what Dr. Hema just said. So a lot of people, I'm in very much stress, so just avoid it. The best way is, doctor, do you have any suggestions for them?
First thing is, don't touch your scalp. There's a condition called trichotillomania, and we see these patients come with saying hair loss. And when we try to dig in deep and ask them, and you talk to them, then you see that their stress relieving is they touch their hair and then they pull out some hair from their scalp unknowingly or knowingly, and that relieves the stress in them. And there is a specific condition to explain this, and then we have to treat the patient according to that. So a condition also exists like that.
Right. So we've got a question coming in from a guest. Premalata says that post fever like corona and dengue, how to control the hair fall?
What happens is when you have a stressful condition happening in your system, like stress is also like mental stress also, but physical stress also takes its toll. Like conditions like this, like our participant is asked, she is asked about corona and dengue. So what happens is when you have corona and dengue, what happens is your system is totally upside down, and your immune system is trying to fight out the virus and trying to get it out of your system. And during the whole process, you have so much of fever, all your systems are down, and the food, everything you're eating might be also not as usual. Your intake might be lesser, so your fluids have to be taken care of, and there are so many things happening. And then, of course, the medications. So when you do all this, there is a lot of things happening in your system. I mean, your liver is functioning more, all your blood cells are functioning more, every cell in your body is functioning more, your immune system is functioning hard to get rid of the virus and all those things. So what happens is, when such a lot of action is happening inside your body, the final thing would be loss of hair. Because the hair per se is not something which the body is tuned to, or it's not like programmed to take care of hair as a first priority. For us, it's a crowning glory, but for the system, according to according to how we are made or how the system is made, hair is an unwanted thing. And so first thing to shed would be the hair if your system is not functioning well. So when you have fallen ill, you have to be prepared that your system is going into a phase where you're going to lose hair. That is called telogen effluvium. And to take care of that, what you need to do is, as soon as your system has recuperated, like once you're out of your viral infection and you're getting better, make sure your diet is really good. You take a lot of antioxidants in a natural way, or you can take some medications also. There are several ways now to take antioxidants. And then you can have a lot of protein in your diet, naturally also and in other forms also. And you should have all your vitamins and minerals well. So make sure you're having a very, very well balanced diet. And this is going to happen for about, what usually people do is, once they get sick, then they follow up some medications, 15 days, 20 days, and they feel better, they say, I'm fine. But the hair loss starts after some time. Usually it's anywhere between 1.5 to 3 months. Or a little later, because the telogen effluvium sets in, but it takes some time for the hair cycle to go to that phase and start dropping off. So you might never realize that you're having hair loss because of that. You suddenly say, I was fine all the while, I had corona, that time also I was fine, and now my hair is dropping. Yeah. So when you have that in mind, then you have to realize that whenever your system goes through some form of stress, be it physical or mental, there is going to be a hair loss. And to take care of that, you need to take your multivitamins for at least 6 to 9 months. And if you are having some other problem, because when you have such problems, your hair scalp also gets irritable, maybe because of the dandruff or because of the other changes happening in your system. So you might need some help, like it has to be overall care. You have to make sure your scalp is maintained clean, your irritation on the scalp is taken care of, then you are eating well, you are having enough of fluids, you're making sure you're flushing off all the toxins in your system. All that has to be done, and then eventually when the hair falls, you have to make sure you're taking care of yourself again very well. Right. So if you do that, yes, the hair fall can be controlled, and if not controlled, if the hair loss is going to happen, the hair falls but it will grow back. But if you don't take care, then the hair will not grow back and you're going to have a problem.
Right. So in order to avoid permanent hair loss, guys, so what Dr. Hema has told, few points: have a balanced diet, take care of your vitamins, take care of your meals, have a lot of fluids, avoid stress, because stress in any form can come because of the disease or because of any other concern surrounding that disease. So avoid stress, have a balanced diet, have a lot of fluids, and take your medications on time. So that's what Dr. Hema told. Right, moving on, we have got another question coming in from our guest, Mr. William. Mr. William says, how to find out what kind of skin is mine? Ma'am, like oily or dry?
This is a very common question asked, but if your skin is oily, then you feel the greasiness of your skin. Like if you washed your skin, and if you're after some time you feel very greasy, then you have oily skin. But if you have dry skin, then you are going to feel the dryness. Sometimes dryness is just how you feel. Your skin doesn't feel good, or it doesn't have the sheen. It needn't be shiny or shimmering, but it has to have the sheen of good health. When you have a good skin, it has got a sheen on it. And that, if it is missing, then you have some amount of dryness, you can take care of that. Apart from that, if your skin is dry, then you can have scales on your skin. So that is also dry skin. Otherwise, on your face only oiliness bothers. Body parts, I don't think it's too much of an issue. Very rarely you might have some problems of having oily skin all over your body and having an issue with that.
Right. So I'm sure that answers your question, William. How to find out that your skin is either oily or it is greasy. You have to find out the sheen in your hair. Right. So, second question that we have, next question we have is that what are the tips for dealing dandruff and dry skin?
Well, I've told quite a few tips already.
Yeah.
So what you can do is you can keep your scalp hydrated, use ketoconazole or oxyconazole or some antifungal element in your shampoo. And if you have very severe dandruff, then we ask the patient to use some leave-on, antifungal agents also on the scalp at times. And if it's very severe, then they might need some oral antifungals also at times. It depends on how bad your problem is. And sometimes what happens is when you are coming and you're saying you have dandruff on your scalp and you must be having it for a very long time. So it could be a psoriatic condition also. So that also needs to be ruled out. So that has to be treated differently. And so when you take care of all these things and use the correct, cleansing agents, and not only using it for a very short period. Usually what people do is they want treatments within 2 weeks or 3 weeks, but skin doesn't work like that, neither the scalp works like that. Of course, the scalp is part of the skin only, so it doesn't work like that. So you have to use it a good 3 to 6 months, and then slowly it'll get better and improvise, and then you feel the inflammation has come down drastically, and then your hair growth improvises well.
So, is there a quick way to reduce your dandruff?
Yeah. As I said, you can have topical agents. You can use topical. There are lotions available, creams available, which can directly attack the fungus if it's very severe on the scalp. So within about 2 weeks, all this will be gone. But to maintain it and to make sure it doesn't get back, then you have to take the long-term treatment of using regular cleansers or regularly what needs to be done. Your dermatologist will be the best person to advise that.
Right.
But suggestive, just because you have dandruff, don't try to use all the harsh chemicals and say, no, it's oily, so I have to dry the skin. No, don't do it. Whenever you have dandruff, your scalp is very sensitive and it needs to be taken care of. So please take care of your scalp.
Right. So take care of your scalp, and definitely there are treatments available. Go see a doctor, go see a dermatologist in case you have got severe dandruff. So we've got another question coming in from our listener. Jayashwi says that what is the most effective way to reduce frizzy hair and split ends?
Frizzy hair and split ends are a sign of less protein in your diet. As a doctor, I can point that out first. So what you have to do is increase your protein content in your diet. But whenever we say that increase your protein content, then the patient says, no, yeah, I have a lot of protein. But then the fact remains that they don't have it consistently and for a longer period of time. So what you have to do is you have to take it for a longer period of time. And sometimes what happens is your hair gets frizzed out. And if you have split ends, that again indicates that your diet is not good enough, and you should take good diet, and indicates that your hair is quite dry, so you might need a conditioner or might need an oil or a thicker kind of a oil which can actually condition your scalp and hair naturally.
Right. Any kind of foods you would recommend for them?
High protein diet, and that doesn't mean that they take a protein shake and just mix it up and take it up. No, you should have natural foods also. Apart from that, if you need some protein shakes, might be.
So we have taken up topics around dandruff and dry scalp. Now moving on, we have got a topic around greasy hair. So how to take care of greasy hairs, ma'am?
Well, greasy hair is again, some people have a problem, like genetically they are, end up with a lot of greasiness on their skin, and hormonal changes also has, adds to this. So when you are going through this hormonal phase of your usually puberty or pre-pubertal we call it. So if you have at that phase, yes, it can get greasy because of the hormonal changes. But then what actually happens is once this greasiness, which is due to more oil secretion from or into your skin through the sebaceous glands. That's the oil secreting glands. When such things happen, then what happens is the scalp stays greasy and it attracts a lot of dust and dirt, and then encourages a lot of fungus to grow, and again you end up with your dandruff. So you will have to use certain kind of cleansers or wash your hair regularly, but don't use any harsh cleanser to make sure that the scalp dries off. No, you cannot do that. What you have to use is you have to gently cleanse your scalp, and you cleanse it maybe every alternate day, or find a way how to keep your greasiness off, so that the other problems don't step in.
Right. So now another topic that has been concerning a lot of listeners is psoriasis. So how to protect your scalp from psoriasis, Vera?
Well, psoriasis per se is a skin condition where what happens is the skin doesn't, like what in a normal person, if you have to say, the skin regenerates. So what happens is dead layers of the skin go off and then new layers of the skin come in. That is why we insist on a bath, and some people rub themselves really well during their bath so that they get rid of the dead top few layers of the skin and fresh skin keeps growing from inside. But in case of psoriasis, what happens is the dead layers, when they are going off, they don't fall off. The genetic coding is actually damaged in such a way that it holds onto the skin and it forms a silvery layer. So then you have thicker skin on your scalp, and you have a lot of skin just staying there. So when such things happen, yes, you need a lot of help, because what happens is psoriasis not only that it causes the scaling in the scalp. One more thing it does is there's a lot of inflammation on your scalp because of the disease per se. So that's how the disease course goes, So in those conditions, we really have a problem. So what you have to do is we have to use some, depending on what the scalp needs at that given point of time. If the inflammation is very severe, then we have to use some steroid lotions maybe, and then sometimes tar shampoos, tar topical applications. And then, one thing who works well in psoriasis is also coconut oil helps a lot. And so you can use that also, and make sure your scales are softened quite a bit. Usually, when I was studying in UK, what we used to use is, they used to give a cocoa mix. And I was wondering what this mix was, because this was made in the pharmacy in-house and given to the patients. And we figured out that they use coconut oil, which is very creamy because the climate there is quite cold. Yeah. And then they used to add salicylic acid in that. And it used to work really well. And then I was thinking, oh my God, we never realized that. And they have a lot of research papers to prove that it helps a lot, So coconut oil really helps. So you can use your coconut oil to soften the scales away if you have psoriasis. And then, of course, you should be using your other creams also, depending on what is needed at that given point of time. So your dermatologist will be the best person to explain that to you. And then using tar shampoos also helps a lot.
Right. So coconut oil is got multiple uses, as Dr. Hema told. It can help you reduce frizziness, it can help you bring down psoriasis concerns, and it can be useful in multiple other uses as well. So guys, moving on, we have got another question coming in from a guest which says that what are the common hair products that can cause itchy scalp?
That's a very unfair question to a dermatologist, I should say, because you don't want me to point out things that don't use this, don't do that. Then to make it very general and make it very fair for everybody, sometimes some ingredients don't suit. Like if you are going to have something like which has got a lot of alcohol, or which is going to like a bleach, a very strong bleach sometimes people use. And then if you have allergy to SLS, all these things can add to your irritation on the scalp. So try to avoid these ingredients in your, if you have a problem. If you don't have a problem and if you're fine and you are, I've seen younger people who come and then we say, oh no, you shouldn't use it. They say, no, I'm absolutely fine, I'm healthy and I'm ready to face it. And then, yeah, please, those things, you can't stop them. So it's an individual choice they make. And but if you have sensitive skin and you have a problem with your skin and you're very particular about your hair and you have a history of hereditary hair loss, and if you have all those problems, then think and then decide if you want to use those ingredients in your scalp products or if you do not want to use it.
So you know your skin better to be able to answer that question for you guys. Which kind of hair products are not useful for you? You should find out what kind of skin type you have, right? So we've got another question coming in from Mr. William. He said, I got your explanation around hair fall after fever. I got corona before 6 months and no hair fall now. But white hair, how can I control white hair?
White hair is again a problem because, as I said, your system has it takes a toll on your system. The virus is not going to be sitting quiet, okay? So virus trashes everything in your system. And I did mention that during your hair loss also you can take antioxidants. So this antioxidants makes the difference. So the graying also happens because of the oxidative stress which is happening in your scalp because of the disease per se and because of the stress your system has gone through. So this oxidative stress is one of the reasons for graying. Of course, it can be genetic also, and then aging also could have, because I haven't asked your age, so I cannot say if you're a 60-year-old gentleman and you're having grey hair after that. I cannot say no, it can be reversed. No, if you're younger, then of course you can take good care, and there are quite a lot of medications as of now. You can take first your antioxidants, and you can take good food, good diet, and we usually ask the patient to take a lot of greens and fruits and vegetables, and that would improvise. Apart from that, there are some medications also to use. Apart from that, there are some lotions which can be advised to use, which reverts graying of hair.
Right. So we need to understand about your genetics and also about your age, Mr. William. But yeah, in general, what Dr. Hema informed to you, I think you should take care of your health, and then there are a lot of things that you need to do to be able to reverse or probably control graying of your hair further. So moving on, we've got, I think we'll take the one more question because we are almost over with our time. So how to manage postpartum hair loss? Postpartum in itself is a long, has got a big topic. A lot of ladies, have got a lot of questions around it. So it was a very popular question, but we're just taking it towards the end. How to manage postpartum hair loss, doctor?
Well, postpartum hair loss is, it's not a problem actually, but it is just natural. It is going to happen whatever it takes. Those days during grandmas used to say, the child smiles at you and your hair is all going to fall off. And everybody would say, why would that happen? The child smiles and my hair falls. So that actually what happens is when you're pregnant, your hormones holds this hair really well, and your hair is pushed to a phase where the fall phase is stopped actually. So what happens is when you're pregnant, your hair is quite good if you're having a good diet, and we usually very uncommonly you see, I wouldn't say rare, it's uncommon to see hair loss during pregnancy. Unless you're having some issues, yes, they do come forward with hair loss, but it's quite uncommon. So you wouldn't see it because of your hormones holding very well and making sure that the hair fall space is completely wiped off. But then after the 9 months, after some time, when your hormones are all, it's such a deluge of hormones which happens when you're pregnant, and after that it's such a sudden fall again. So with all that, the hormonal changes per se causes the hair to be pushed to the falling phase, that is the telogen phase. So that's why this hair loss is called telogen effluvium. And usually what happens if you're taking a good diet, if you're taking good care of yourself, and if you're taking good care of yourself postpartum also, which is probably up to a year, especially if you're nursing your child, then the hair loss can be controlled and the lost hair will grow back.
Right. So a lot of women would be relieved with that answer that your hairs will grow back, right? So this sums up our today's topic, guys. Thank you very much for joining us. I'm sure this session has been very helpful for you. For people who asked us a lot of questions, I'm sure you got your questions answered. Even if you have got more questions, please drop in your comments on this video below, and we will come back to answer them for you. And we've got a WhatsApp platform on Cureka.com which you can use to ask any question around any sort of a health concern, whether that is related to hair care, skin care, baby care, maternity care, elderly care, or any sort of a health care issue. We have got highly curated products which are handpicked by doctors for you on Cureka.com. So trust these products. Millions of people love them. Go to the website Cureka.com and find out what is best suited for you. So I'm your host for today, Rahul Anuhal. Thank you very much, Dr. Hema, and thank you all.
Thanks a lot. See you soon sometime.
Yeah.